Welcome to Medical Terminology Basics 2 of 2. We talked in our previous session about spelling. Spelling is very crucial. We need to pay close attention to it because they can have different meanings. You can see we have leukocyte, C-Y-T-E, and cystitis are very close with their spelling. But cyte, C-Y-T-E, is cell. So a leukocyte is a white blood cell, whereas cystitis, cysto, is a root word that means urinary bladder. So cystitis is inflammation of the urinary bladder. Here's a few more spelling close calls. We have tomy, which is a suffix that means cutting. We can add the root word cranio. Craniotomy is an incision of the cranium or the skull. Versus the suffix stomy, the only difference here is that S, which means creation of an artificial opening. And a common procedure would be colostomy, which is an artificial opening in the colon to the outside of the body. A few more close calls, and this time with root words. Arthro, which means joint, arthrotomy, incision into a joint, versus athero, which refers to the yellowish plaque that can build up in our vessels. So atherectomy would be the removal of plaque in a vessel, and usually that's from an artery. Let's try some more words. We have the root word osteo connected to the root word arthro with our suffix itis, creating osteoarthritis, which is inflammation of the bone and joint. We could have hepato with itis, creating hepatitis, which would be inflammation of the liver. Take that same suffix itis and attach the root word appendico, and we create appendicitis. Notice how we've dropped that combining vowel in both hepatitis and appendicitis. And the reason is because our suffix itis begins with a vowel. Continuing on, we can take a different suffix, ectomy, which means removal, excision, or resect. And we can add appendico, dropping the O. We have appendectomy, removal of the appendix, tonsillectomy, removal of the tonsils, or hysterectomy, which is the removal of the uterus. The combination is endless. We can take the suffix scopy. We can have broncho for bronchoscopy, colano, colonoscopy, laparo for laparoscopy. Remember, scopy is the process of visualizing. So a bronchoscopy, they're visualizing the bronchus, or the inside of the lungs. A colonoscopy is the process of visualizing the colon. A laparoscopy is a visualization of the abdomen. Now, in order to perform that bronchoscopy, colonoscopy, or laparoscopy, the instrument that they use is a bronchoscope. Scope is the instrument. So a bronchoscope is the scope that they use to look inside the bronchus, or the lungs. A colonoscope is a scope that is used to look up into the colon. And a laparoscope is the instrument or scope that they use to look into the abdomen. They're all different because they have different requirements. They have to be different lengths. Okay, time for a knowledge check. The procedure of visualizing the bronchi and inside the lungs is A, bronchoscope, B, bronchitis, C, bronchiectasis, or D, bronchoscopy. I'll give you a moment and we'll see how you did. And the answer is bronchoscopy. Well done. Now, you may have to create words another way. You may have to create that medical term from its English meaning. The doctor could write on the chart, inflammation inside the heart. This is where knowledge of our word parts comes in handy. If we know inflammation means itis, we know inside, the prefix is end, and the heart refers to cardi, we create the word endocarditis. Inflammation of the skin. We know itis is inflammation, and the root word for skin is dermato. So we've created dermatitis. See, again, we dropped that combining vowel O. An abnormal of the condition, kidneys. Nephrosis. Osis means abnormal condition, and the root word for kidneys is nephro. Lastly, a clotting cell. Cell means site, and clot means thrombo. So a clotting cell is a thrombocyte. Oh no, another knowledge check. The excision of the kidney is nephroplasty, nephrolithotomy, nephrectomy, or nephritis. Let's see how you did. Nephrectomy. If you know what excision means, you would be able to identify that suffix ectomy. So regardless of the word, all of those four words, nephrectomy has the suffix that identifies excision. And another knowledge check. A disease of the valves inside the heart is A, cardiomyopathy, B, endocardiopathy, C, pericarditis, or D, endocarditis. I'll give you a moment. And the answer is endocardiopathy. Well done. Endo means inside. So if you saw inside, what word part has endo in it? Well, we have two of them. But then we have disease. And we know the suffix for disease is pathy. So endocardiopathy would be our correct medical term. Now, there are words that have more than one meaning. Salpingo is an example. Salpingo means tube, and it can refer to the eustachian tube in the ear. We could have salpingitis. It can also refer to the fallopian tube because it also is a tube, salpingitis, which is in the female reproductive system. So we have to pay close attention to what we're reading in the anatomical part. Few more double meanings. Cervico. Cervico means neck. Well, there are necks in different parts of the body. We can have cervicalgia, which is referring to the neck region of the spine. Algia means pain, therefore cervicalgia would be pain in the cervical vertebrae of the spine. It can also be referred to the female reproductive system. Cervicitis, which is inflammation of the cervix in the female reproductive system. And a few final thoughts. The more medical terms you have memorized, the easier your future classes will be. Make yourself or purchase flashcards. Use them daily. Memorize in small chunks, 30 at a time. You just keep going through the same 30. And then once you know one, you can put it in the I know stack and replace it with something else. You don't want to get yourself overwhelmed. You're not going to learn all these words in 6 short weeks. It's an ongoing process, folks. Begin by memorizing your suffixes because every single medical term does have that suffix. Then move on to your prefixes. There are fewer prefixes than suffixes. And then lastly, you'll build your combining forms as you learn and go through all the chapters in your book. Now, did you know that if you teach terminology or teach anything to anybody else, friends and family, you have a 95% retention rate? That's awesome. Utilize the web for free language of medicine games. Most importantly, in your writing, always be mindful of your spelling. If you have trouble with pronunciation, it's okay. We all do. Utilize the freemedicaldictionary.com, or really my favorite is the Merriam-Webster dictionary.com. Merriam-Webster.com, because it is a one-stop shopping for all your English needs. It has a regular dictionary, it has a thesaurus with antonyms and synonyms, and it has a medical dictionary as well. Thank you for listening, and enjoy your learning.